Good morning, everyone. Today is Thursday, July 19th. Thank you so much for joining into our weekly healthcare reform webinars. I appreciate you taking time out of the busy schedules to join in and become the resource for your clients. If you're new to the format, my name is Deb Wilkinson. I'm the Vice President of the Health Plan Options Department at URL. My duties include overseeing the traditional group health markets, the self-funded, the reference-based pricing, all of that, as well as short-term medical, and as I always say, what's left of the individual market in the state of Pennsylvania. So I do give legislative updates, both on the federal level and the local level, and hopefully you find this information helpful for your clients, but questions are definitely encouraged. I'm not out in the field. I am, working for you, so I don't know what questions are being asked of you from your group clients, but certainly would welcome any questions because it just makes us all better. And goodness knows with this crazy law and what we've had to deal with for the last, well, quite frankly, 8 years, we're all in this together. So we're going to start with the agenda. Just before I get into the actual agenda, if you can just, with your electronic hands, you can let me know if you can see my screen and hear me okay. Don't see any hands. Let's see here. Okay, we have some hands. So everybody can see me and hear me okay. With your electronic hands, that's also the way you can ask questions, and or you can type them into the question box and I'll answer that at the end of the webinar. So let's get into the agenda. We've talked the last couple of weeks about the association health plans. There's still not tons of direction, certainly not from our insurance department, at least that I'm seeing. Our Pennsylvania Association of Health Underwriters Legislative Committee is definitely working with Commissioner Altman in Pennsylvania to obtain more details. The carriers are gathering information. They want to know level of interest for anyone working in an association. So if you're on this webinar and you are in charge of managing an association or have an in with an association, then I would encourage you to work with the carriers to at least get your place in their list so they can start working with you. Of course, we're here to help you with any association plans with our Ben admin systems and some of our services that we can offer. So again, if you are an association, go ahead and reach out to those carriers or reach out to me. I'm happy to help. But again, we'll see what happens with our state. I've said all along that I think that the associations that are currently in place, that are valid associations, have their bylaws, do services other than, join together for insurance purposes. I think that there won't be many challenges for that segment. I do think that new associations will probably be scrutinized pretty heavily, and I'm not sure in our Commonwealth how easy the insurance commissioner is going to make new associations coming in. But again, I'm going to follow this and I will share these details as they come in. We've also talked about the risk adjustment payments, that they were suspended. CMS announced that the payments would be suspended. Rates for 2019 that have been filed could now be subject to change. I've not heard particularly for Pennsylvania, if that's going to be allowed to happen. I just know that carriers are kind of trying to digest this and figure out what the strategy would be. And of course, more direction is going to follow, not only from the Pennsylvania Insurance Department, but for those of you from out of state, would follow with your own insurance commissioners. There is some information about possible reversal, that they might allow the risk adjustment payments to be made. There's challenges. So we'll see. We'll see how it all works out. But at this point, it's just breeding instability. And unfortunately, that's what we have to deal with the dismantling of this law. There is some good news. Representatives Nunes and Kelly in the House Ways and Means Committee did introduce some bill and did some markups that would temporarily repeal the employer mandate and suspend penalties for the employer for the 2015 through 2019 segment. So that's pretty encouraging. The markup also included delays, and I put yes, another one, to the Cadillac Tax plan, or Cadillac Tax for the expensive and high-end health plans, which, you know, everything's expensive now, but that was kicked down, or going to be kicked down the road if passed until 2022. Other committee members, Roskam and Burgess, introduced a bill that would allow tax credits to be used for non-marketplace plans and allow for persons older than 30 to purchase catastrophic coverage. This could be interesting. And other markups included expansion of use of HSA funds. All of these things are kind of interesting, but, you know, again, it's creating a lot of chaos. And, you know, here's one too. With one of the bills, or one of the markups, specifically HR 6311, it would, you know, of course, expand use of subsidies for off-marketplace plans, but there are several states that this could present a challenge. Pennsylvania is one of them. HR 6311 would restrict the use of ACA premium tax credit subsidies to plans that comply with the ACA underwriting and benefits requirements, and to plans that exclude coverage for abortion. So state mandates within New York, Pennsylvania, Oregon, and Washington state require that abortion services are covered. So could be a challenge unless we change the law within Pennsylvania. But again, more to follow. This is just at the beginning. Incidentally, these are supposed to hit the House floor for a vote. Aetna-CVS merger. Rumor says that the Department of Justice won't challenge the $69 billion acquisition, so we'll keep watching for that. That could really, you know, it could really get some shock going into the market. CVS, of course, is a drug dispensary or a drugstore, and then Aetna is a health carrier, so it's going to be kind of interesting. Additionally, CVS is the prescription vendor for Capital Blue Cross. So again, I'm wondering how that's all going to work, but we'll keep watching that as well. Medicaid rules, Secretary Verma said that the Medicaid work rules would become more clear in the very near future. So that is something that each state is kind of dealing with, and we'll watch that as well. So let's get on to the agenda. Pakora fees, they are due the end of this month. So employers with, and generally for for fully insured folks, these are calculated and paid by the carriers, but employers with general purpose FSAs and HRAs integrated with self-insured plans must be mindful of the due date because they have to calculate and pay and file for the Pakora fees. So just be mindful of that. There is a flyer in your handout, so you know, just pull up that information or shoot me an email, and I'm happy to send that to you. So here's a big one. Geisinger's network, Tower Health Reading Hospital System, is no longer in their network as of 10/15 of this year. They are working with UPMC Tower Health and trying to negotiate and come to an agreement, and we'll certainly keep watching for that. But, you know, that's a huge disruption in the market midstream, so could be very, very challenging if Geisinger, if you're in the Reading area insured with Geisinger, and, you know, we'll have to kind of scramble for network providers. But hopefully we'll have some positive information and more information as we get closer to that date. And just so you know, that, I mean, we all know that these things happen. They've negotiated before with different hospital systems, and in the 11th hour have come to an agreement. So we'll see what happens here. But, you know, at this point, 10/15 is the D-Day. UPMC group billing changes. This is not terribly important, but you may have questions from your UPMC group clients. Employers will be billed on the 10th of each month, and of course, if the 10th falls on a weekend, then it would be the next business day, and the previous billing cycle was the second Sunday of each month. So not a huge change, not hugely important, but just wanted to mention it in case you're getting questions. Upcoming events, we talked about this, September 5th, our annual Medicare Connections Conference at Hershey Lodge. Save this date. Actually, the invitation has been going out, so if you have any interest, go to our website to under events and go ahead and register. It fills up very quickly. It is free. There is no charge for admission, but what you'll see is the carriers talking about what you will expect and what you will be selling for the 1/1 sales season, your annual election period. So again, it's well attended. If you're in that segment or looking to get into the Medicare segment, I would encourage you to save this date and register for this event. Another event, Central Pennsylvania Association of Health Underwriters is also having a Medicare Summit. This is the first one that they've done. It is on September 13th at the Holiday Inn East. There is a charge for it, but again, if you are in this Medicare segment, this might be of interest to you, and once more details are available, I'll certainly share those with you. And last but not least, August 1st, 2nd, and 14th, there is UPMC territory expansion meetings. If you are one of the expansion territories, we are in Central Pennsylvania, of course, Tower Health and Reading area, and then the Northeast segment. I would encourage you to look at these, the invitation in my newsletter, and register for a meeting. Last but not least, yesterday ended the FFM certification for the 2018 selling season. So unfortunately, if you are eligible for commissions and you're selling in the individual market and have not certified, then you would not be eligible for commissions for anything you sell in 2018. So just wanted to let you know that. And on that note, we'll open it up for some questions. And as always, I thank you for joining in. So let's see what questions you have. Hopefully. Oh, conference is 70% full. So the Medicare conference, if you have any interest, get registered now because we will have to cut it off. And that is about it. Those are all the questions I have today. So we will not be having a webinar next week, Thursday the 26th. I will be on vacation. I just thought this Lonely Beach umbrella was speaking my name this morning, so I won't be here next week, but I will be back the following Thursday on August 2nd, and we'll catch up with everything going on, not only in Pennsylvania, but nationally as well. So as always, I thank you for joining in. I wish you all a great balance of the week and a wonderful weekend. Bye-bye.